If you or someone you care about has been diagnosed with chondrosarcoma, then consider the Moffitt Cancer and Research Center in Tampa, Florida. Meet Tim Collins as he describes his recent experience with Moffitt.
Sure, I was in the ER in Orlando for a separate issue. I was having some chest pain in the upper left side of my chest. And as part of their routine test that they would do, they performed an x-ray. That's when they found a tumor in the top left portion of my chest. They followed that up with a CT to determine that it was worthy of a biopsy. Upon doing the biopsy, I then met with a pulmonologist in Orlando as a follow-up. He confirmed that it was chondrosarcoma. Because he wasn't an oncologist, he referred me to talk to an oncologist at that point. Luckily, that's when we learned about the Moffitt Center, and we made an appointment immediately to talk to their oncologist staff. I was extremely impressed upon walking into the Moffitt Center in Tampa. I met with Dr. Gonzalez, who was not only an oncologist, but also a surgeon. When I met with him, he looked at my CT results and my biopsy results. He saw that I had the chondrosarcoma and the second rib on the left side front of my chest, and he knew exactly what to do. He was an incredibly knowledgeable, incredibly experienced oncologist and surgeon. He came across as just a no-nonsense, very knowledgeable, well-informed oncologist and surgeon. For the actual surgery, they resected the first and second rib on the top left of my chest, and also the tumor, which was roughly the size of a small lemon. Following that resection, for rigidity purposes, they use a bovine material called stratus, and they make it about as taut as a trampoline. That applies rigidity to that section where the ribs were removed, and it also ensures that the muscles don't adhere to the chest wall. They applied all the sutures, and they use an adhesive on my chest, so you wouldn't actually see the stitches, just an adhesive. Following the surgery, the recovery in Moffitt was pretty good, but there were some times when it was quite trying. I would say if you cough or sneeze, it could be quite painful. That's just a normal side effect from the surgery, but with plenty of pain meds, it was very tolerable. And my overall condition improved quite quickly. It's only been 2.5 weeks from the surgery, and a lot of my friends and family are quite amazed at how far I've recovered so far. So, like at this point, as long as I don't cough or sneeze, I feel fine. And I do have a weight restriction on the left side. I can't lift more than 10 pounds, so I don't try to lift anything with my left hand. Otherwise, feeling really good at this point.